In recent years, there have been incredible advancements in the field of oncology, the study and treatment of cancer. These advancements have not only increased survival rates for cancer patients, but they have also improved overall patient outcomes. Today, I want to dive deeper into how oncology has made a significant impact on patient outcomes. One major factor in improved patient outcomes is early detection and diagnosis. With advancements in imaging technology and better screening methods, cancer can now be detected at an early stage when it is more treatable. Regular screenings, such as mammograms or colonoscopies, can help identify cancer in its early stages, allowing for prompt treatment and ultimately better outcomes. Early detection means that treatment can be initiated earlier, potentially preventing the cancer from spreading to other parts of the body. Another aspect that has contributed to improved patient outcomes is the development of more precise and targeted treatment options. Traditionally, cancer treatments like chemotherapy were known for their harsh side effects. However, with recent advancements in targeted therapies and immunotherapies, treatment can now be tailored to the specific needs of each patient. These newer treatment options are not only more effective in killing cancer cells, but they also have fewer side effects, leading to a better quality of life for patients. Moreover, research and clinical trials have played a crucial role in improving patient outcomes in oncology. Clinical trials help to evaluate new treatments and their effectiveness, providing valuable data that allows healthcare professionals to make informed decisions about patient care. By participating in clinical trials, patients not only have access to cutting-edge treatments, but also contribute to the advancement of cancer research, potentially benefiting countless others in the future. Additionally, advancements in supportive care have significantly improved patient outcomes. Supportive care focuses on managing the physical and emotional side effects of cancer and its treatment. This encompasses a range of services, including pain management, palliative care, and psychosocial support. By addressing these aspects of care, patients experience better symptom control, improved quality of life, and increased overall satisfaction with their treatment experience. In conclusion, the field of oncology has made tremendous strides in improving patient outcomes. Early detection, targeted treatments, research, and clinical trials, as well as advancements in supportive care, have all played a vital role in increasing survival rates and enhancing the quality of life for cancer patients. As research and technology continue to advance, we can expect even greater improvements in oncology and patient outcomes in the future.